The fourth pillar is essentially just a framework. It's a framework. It's not a new specialty. It's not a new checklist. It's a framework to guide how we think and evaluate patients as it pertains to women's sexual health. So, if we look at women's health in general today, women's health is founded upon three pillars. One is reproduction, meaning taking care of mom and baby. We're real good at that. Number two is disease specific treatments. I mean, we're helping women with specific diseases, whether it's uterine fibroids, cancer, any number of disease processes. The third is longevity or preventative medicine. The interesting thing is each one of those three pillars has clinical pathways, it has training infrastructure, and research infrastructure. But what hasn't had a chance to sit at the table is women's sexual health. Women make up half of the country, right? And so having a standard, having a framework to help us guide the way we think about women and women's sexual health is important. Now, how I came up with this idea was that I actually lived the experience. I mean, I was 340 pounds. I was recently married. I have a child on the way, and my wife is 19 years younger, and I had to change. And so what I did was a gastric sleeve, lost lots of weight. I was sitting around on the couch, and a commercial comes by talking about testosterone and all these things they can do for men. I make an appointment, and when I get there, they ask me a few straight, direct questions. They say, is intimacy a meaningful aspect of your life? Uh, do you like the way things are functioning? Do you feel like yourself? Well, obviously, I gave them the answers. I got a plan, I got a treatment, and things improved. So what we so it was then that I got smacked on the head and realized that after 16 years, I've never asked my patients how they feel. What are they experiencing? Is intimacy meaningful part of their life? And so that's what changed the way I thought, and that's what led me to get education. And so what I did is I left a 17-year employed safety, and I found Dr. Michael Goodman. Dr. Goodman is a sexual medicine fellow with ISWISH, the International Society of the Study of Women's Sexual Health. He was also a menopausal practitioner, and he also wrote the first book when it comes to aesthetics regarding the vulva and the vagina. And so I spent 18 months with him. And with that, him being 78, coming to the end of his career, he was ready to maybe pass this baton onto somebody who will carry it a little bit further. And that's where we are today. And here we are talking to you and hopefully spreading that word that women's sexual health matters. Women's sexual health needs to sit at the table. And there we have it, the fourth pillar of women's sexual health.